Wednesday. I hope y'all can hear me. Maybe somebody give me a thumbs up or a hello. You guys have a chat box here. You can ask questions as we go. I'm Sue Hitzman. I'm the creator of the Melt Method, and we're going to get going in just a few minutes. So sit tight and let's talk about cellulite. So if you're going to work with me today on this, I am wearing short shorts. I would have worn a bathing suit, but that might have gotten a little bit X-rated for YouTube. Maybe not, but maybe. Maybe more people would watch and learn. So yeah, so I'm going to give you guys a little chat on this dreaded topic, this horrible, horrible affliction. I hear we have this condition we're going to talk about. And of course, if you have any questions as we're going through this, feel free to leave it in the chat box. Oh, I love that Kay is from Cape Coral. I used to live in Cape Coral. I duly noted at Cape Snorkel. And so I moved to Naples, which I can't really say is any more exciting, but it's definitely beautiful down here. So we'll get going in 1 minute. Again, you guys have any questions? Let me know if any of you guys have not experienced melt. Let me know, because that's a couple of the techniques I'm going to teach you today are melt techniques. But I'm also just going to teach you how to touch yourself. It's interesting. This is the second day where we're talking about we should all touch ourselves more, which is true. We should. Okay. So it's 4 o'clock. Welcome. I'm Sue Hitzman, creator of the Melt Method. Welcome to today's very traumatic, detrimental to your health topic. It's cellulite. Yes, I can't even get over it. So I know that this seems to be a real bane of women's lives, especially this time of the year. If you're living in cold climates and suddenly it's warm out and you're going to put your shorts on and all of a sudden you catch a glimpse of your backside in your mirror and wonder what in the heck happened over the wintertime to the back of my thighs. So this is one of these huge topics that I get asked a lot about. I feel extremely well versed, and I'd like to maybe give you guys a little bit of insight on what is cellulite, and then why it's there for some people and not for others, and then how can we help ourselves to minimize the appearance of cellulite. Now, I want to really make sure you're hearing the words of minimizing the appearance of, because to me, I remember Gil saying to me, you can't get rid of cellulite just like you can't get rid of your tibia. And I love that idea because, first of all, what is cellulite? And I'm going to show you some images here and try to demonstrate a couple of things so that you actually understand what it is and the fact that some of this is just natural, okay? So first of all, there are a lot of articles out there where they call cellulite a condition. Pregnancy is a condition, but cellulite's not a condition. It's not a disorder. It's not a disease. You're not pregnant. It's just fascial anatomy. So I want to show you an image, and I'm very privileged to know my dear friend Gil Headley, who is a brilliant educator on so many things, and one of the things he talks about a lot is connective tissue. And in our dissections, one year he came up with this idea. Now what you're seeing here, this is superficial fascia with the fat still remaining. So if I were to grab this part of my skin, and if I just remove the thin layer of skin, this part, this is still superficial fascia. Your connective tissue is adhered on the underside of your skin to fascia. Now, some of us have thinner skin than others, so see if you can even pinch your skin and let it go. What happens? Do you have skin like this? Or is yours a little inflamed? Does it feel thick and kind of grizzly under there? Okay, so if I were to grab this piece of my tissue, now this is actually abdominal. This was an abdominal wall, what you're seeing here. But this is the superficial fascia with the skin removed. So the skin would be on this layer, and this is just a layer of fascia and fat. And what I want you to really see is the texture. Now, people say, well, fat has a texture, but dare I say that connective tissue is what has a texture. Fat is just a cell. It's a circle, right? And it deposits differently in different areas. So what Gil did was he took this layer and he took this meat cleaver and he started to massage this in a saline solution. And here what we did is we removed all of the fat. And do you see it? Do you see the texture of it? Yeah? And this texture is kind of like a sponge, okay? So very similar to your own fascia, under your skin, you have this layer of connective tissue called superficial fascia. And the superficial fascia is more of an areolar or fluffy kind of fascial tissue. It has a lot of sponge-like quality to it, and for good reason, because in here we have blood vessels and a ton of sensory nerves. There's actually more sensory nerves living in fascia than there is anywhere else. So this layer here is where the fat deposits, and these little nooks and crannies, these are called multi-microvascular spaces. This is where fluid should be, and when the fluid's not there, fat occupies these little nooks and crannies, and it doesn't deposit evenly. So another thing to kind of see is that not only is fat not depositing evenly, that's really only part of the story, because here's the thing about cellulite. You can be thin and still see cellulite, right? Actually, when I was at my leanest, when I was 11% body fat, I could see cellulite more than I do today. Not saying that I'm all that much heavier, but think of this as your skin. Okay, and under your skin you have these fibrous layers of connective tissue. And if I just take what's behind here and I pull on it, I just pull on the threads, can you see how it makes these little dimples? And that's kind of what's happening on your skin layer, is that the collagen is interpenetrated to the bone, and it's like a tether. It starts to pull, and as the fat is here, the fat just starts to poke through because it's just tugging, and you're seeing the texturization of the fat that's sitting right underneath this layer, right? So the fat's right here, yeah? And so you're sort of seeing it. So another good way to kind of imagine this is if I took marshmallows and I put it in a fishnet stocking, and then I gave it a squeeze, you would see how that fat pulls through, but the fibrous elements pull in, and that's why you see cellulite, okay? Now, women, it's like 98% of women have cellulite, and again, they call it a condition. I would dare to say that the 2% of women who don't have cellulite have a freaking condition. The rest of us are perfectly normal. The other 2% of the world, I don't know. But here's another thing to consider. In like the 1920s and the 1930s, if you looked at a lot of the photographs, they didn't do the airbrushing or anything, and they didn't seem to have cellulite, but they were also on their feet more, moving around more. There was more activity. And right now we're quite sedentary in our lifestyles. And the more you sit, the biggest thing about the areas where you tend to see cellulite, on the back of the arms, and of course the back of our thighs, when we sit for long periods of time, or our bodies are still for long periods of time, we lose blood flow. And again, there's a lot of vascularity in the superficial fascia. So if you're not moving it and you're not working on the tissue, you're going to start to see the texturization. Now, another bad news is there are these things called alpha and beta receptors in your body. And guys have a 1-to-1 ratio, alpha to beta. Women have a 10-to-1 ratio, beta to alpha. And we need those alpha receptors because that's what kind of helps to move the fat away and utilize the fat. And so we actually have more of a multi-layered fatty tissue in the superficial fascia. And for one reason in particular is that we can have babies. So it's not a bad thing, okay? First, I hope that you guys are hearing me. The cellulite is, there's nothing wrong with you. And again, the texture of fascia is what I just showed you. It looks kind of like a sponge in the superficial layers. So some of us have a thinner skin. I'm Italian, I got this thinner skin, and so it's here. Now, another thing about cellulite, the people that are complaining about their cellulite is the person, right? I mean, I remember my late husband saying to me, "You have the smoothest skin I've ever seen." And I'm like, you know what? You can't even read a text without your glasses. So here's the thing, ladies. As you get a little older, whoever you're with can't see up close anyway, and they're going to think you don't have any wrinkles or cellulite. And that's also like what this is. That's what causes the wrinkles on your skin too, is the connective tissue tethers. So that's what it is. Now, how can we eliminate what we see on the superficial layers? Okay, first of all, there are many tools that you can use out there, and they've been used for decades and decades and decades. There's in fact a young woman who tells you to blast your fascia and bruise yourself. And if you create an inflammatory effect, you can minimize the appearance of cellulite. But why would you self-mutilate your body as a way to make yourself look better in a mirror? Why would you bruise every square inch of your body to adapt connective tissue? Because here's the thing, you don't need to bruise yourself to change what you see on the surface of your skin, okay? So I'm gonna ask you a question here, and I wanna see a yes or a no in the chat box. How many of you guys at the end of the night do anything that you feel is valuable to eliminate your cellulite? And I wanna know what it is. And then the second question I have is, are you using some sort of cream? Like, do you sit and massage yourself every night? I personally do. I'm going to show you one of the things that I do while I am watching just completely brainless television. We were watching Bad Vegan for the last couple of nights. Oh my gosh. And we were just melting ourselves and working on the back of our thighs. So a couple of things we want to know here, okay? First is, how can I do something for myself, not just for the minimization of the appearance of cellulite, but to do something more important, is to actually enhance blood flow to our skin and improve the tone of our connective tissue. Okay, so maybe it's not something where you're doing this because there's something wrong with you and you need to fix it, but here what we're doing is we're actually enhancing all of the good stuff. So we want to do something to ourselves every day. Yeah, I see a lot of you goes, nope, I don't do anything, right? I complain about what I see, but I don't ever do anything. So first of all, before I even show you any of the melt stuff, like I'm just going to give you an example. This stuff, I can't tell you if it works or not. We just happen to have it in the house. This is called Body Tight Caffeine Cellulite Lotion. Don't you love that? And what it has in it is caffeine, hyaluronic acids apparently, and some collagen. And I think this stuff is actually valid if you, it's not so much about the cream itself, it's about what you do with the cream. So I don't care if it's this or Nivea or baby oil, I don't care, but I would use some sort of a lotion, and I'm going to teach you some hands-on techniques to do to yourself today. So if you've got some sort of cream, we're just going to use a little bit, you don't need a lot. But there's other tools. This is called a gua sha tool. I'm sure some of you guys have seen this. You see how it has kind of this blunt, kind of a curvy edge, and the rest of it is flat. And you can do things where you can actually work into the tissue in areas where you see puckering, and then scrape it up and out. Right, if you really have a piece, and I'll show you, like, I'm sure we can find some area of my legs that has like cellulite. And then this is my friend Christopher Gordon. I love this one. This is called the Fascia Releaser. And you can see it kind of has a curved edge and a flat edge. And sometimes I use this on the back of my legs, and I sit here and work on the back of my legs like this. It's the same thing as using something like this. But I also use the melt roller and my hands most often because it's just the thing that seems to make the biggest benefit for me. But one of the things that will change what you see is just getting blood flow back to the tissue, okay? So I'm gonna show you some hands-on techniques. I would tell you if you got a ring or something on, I'm gonna take my little Aura ring off. And I'm gonna show you a couple of ways to work on your own skin. And it just depends upon how you want to do it. So I don't even know, like if I stand up, let's see if I can give you a little cellulite here. You see it, like there it is, there. See? Right here. Can you see, like if I get the lighting just right, there it is. I got a little ripple right here, right? So if I'm going to sit here and I'm going to work like this into the tissue, this is called skin rolling, and I'm just going to pull this tissue out. Like I've never really cared so much about cellulite. I more don't like the spots on my legs, and again, my late husband used to say, oh, it's the fairy dust that you had when you were first practicing when you were a kid. You probably just kind of got on you. They're constellations, right? So can you see I'm actually taking my fingers and just kneading into it? I can do it this way. I could also grab onto a piece of my skin here Like get where you can on your knee. And we can sit here and we can learn to roll it. You see what I'm doing? I'm sort of backpedaling the tissue all the way up as far as I can. And I can actually feel the squishiness in there. I can kind of feel that fat sort of move. I'm going to do it a few times. Let me see if I can get up real close here, right? So again, I kind of take a piece of my skin, and I'm going to backpedal it. So I'm curling under. Can you see I'm doing this? I'm curling under, and then I'm pulling up. So my thumbs are kind of running it. And if you do this with me, you might actually feel the squishiness. See, I can kind of grab all the way up in here. And after I do it a few times, I'll be able to grab it a little bit more because I'm getting blood flow and hydration in there. So connective tissue does, in the superficial fascia, is, see, I kind of grab that all the way on up in there. I do the same thing in the back, right? So, and I wouldn't be doing it standing, right? The way that I would do this, because it's much better for you, is to take a roller, and you're going to lie down onto it with your hips so that your legs are nice and relaxed. See, I can get my legs nice and loosey-goosey. And I can start up at the top if I want, and I can do the same thing, and I can roll it down. I could roll it out, right? So this is called skin rolling. You don't need anything but your hands. You don't even need cream, unless your skin is like really stiff. Then sometimes cream works really nicely. But again, like I could just sit here and work through all of this and grab whatever tissue I can all around my legs. Right. I can come up onto my inner thigh, and then I can come back to the back side of my leg. Right, and I'll sit here like this, and I love this because I'm kind of working on kind of like doing a lengthening technique of melt, and I just sit here and just massage my tissue, okay? Now, if I were going to do something a little bit even more, I really want to try to get a shear effect, I might even take just a touch of cream. Look how little cream I have, right? I'm going to go ahead, I'm going to put that onto my skin. I'm going to give it a nice rub. What a nice thing it is just to massage yourself, right? And if you have somebody else who will do this for you, what a great thing. But now what I'm going to do is I'm just going to sit here and twist and grab my skin. So my skin just kind of twists, and then I just sort of run my hands around. And all I'm doing is just getting some blood flow, some fluid flow back into the skin layer just beneath my skin. And I'm even going to work where we don't have cellulite. I work down into my legs here. And what this is called is a shear, right? So I'm grabbing my skin and then I'm twisting it. And if you really want to get a little bit more of that and you don't want such the glide of it, right? So like see how my hands get slippery? If I don't have cream on my hands, I can really grab and twist, right? So I'm twisting it as hard as I can and then letting it go. Twisting it and then letting it go, okay? Same thing in my arms. Twist it, let it go. Twist it, let it go. You could even grab and pull, grab and twist, and just get the blood back into the layers where you feel you've got that lumpy texture, okay? And again, I'm twisting the skin, right? I'm actually dragging the skin, right? I'm not rubbing my hands up against, right? I started off like that. I kind of massaged the cream in, and then I just let it sit there, right? But what I'm doing here is I'm grabbing and I'm twisting. Now, doing the skin rolling on your arms is a little bit tough, but some of you guys will be able to do this here if you have that cellulite on your arms. It's another area where it tends to get, again, I kind of like relax my arm a little bit. And if you just grab your skin and roll it, again, some of you guys are going to feel, if you just give it that squeeze, it's kind of like a, because again, it's sort of like working fluid into a sponge. You kind of feel the compartments and the pushing of the fluids in the tissue. Yeah, Dana, you're saying, did you stand up and try it? Or I do it better lying down because my muscles stay more relaxed. I actually want to stay as relaxed as I can, right? So again, what I did was I put some cream on, and then I just let it kind of, and I kind of like went across my skin a little bit. But now that the cream has sort of massaged in, again, what I'm doing is I'm grabbing, and watch how I'm twisting here. And then I let it go. I'm twisting, and I'm letting it go. Twisting, and I'm letting it go. Then I might even take my fingers and just kind of pull and knead, right, all the way down my leg. And really work it. right? And again, on the skin rolling, again, I grab my skin and I just backpedal it. And I come on all the way up. And then I might work back down here on my inner thigh. And then I work down. And I might just spend 10 or 15 minutes just messing around with my legs. Same thing on my butt. You know, like again, when I'm doing it at home, like nobody's around, I might just, you know, be naked. Who cares, right? Just, you know, work on any area that you want. But you see what I'm doing here, right? So I'm twisting and working the tissue in with my hands. And what this is doing more than anything is getting blood flow back into these regions where we lose it because we're sitting on this all day long, right? So I'm just going to sit here and pull. Yeah? And again, if I wanted to use the gua sha, and I found like maybe there was an area that, I don't know, maybe it was a little more textured, I'd sit there with the edges and just give it a little twist. And then I would run it with the gua sha. And again, it's just, again, blood flow. You see I get a little pink? It's just blood flow. I just brought a little bit of blood flow. It's just, you know, you don't want to rupture all the capillaries where you go bruised, but if you get a little bit pink, it's just blood flow. It should just go away in a few minutes. If you're bruising yourself every square inch, you're going too far out your body. Now again, remember, some women, like I have kind of thinner tissue. I'm Italian, so I got like this kind of thin skin. Some people have that much thicker tissue. And so oftentimes heavier girls, like you won't really see cellulite because they actually have a thicker skin. It's just your genetics, right? You know, like just kind of that more hourglass shaped kind of a gal, right? So it just depends upon your body, okay? So now that's a little just, and these like slower tutorials are all on Melt on Demand, by the way. I'm just giving you like some top of the trees ideas. You could even take, here's a resistant band. What's cool about a resistant band is if I were to take it around my thigh, not like a tourniquet, right? And I were to wrap it around, and then I were to do the exact same thing that I just did a minute ago. I'm going to twist. Now you really get the grip on your skin, and you're going to get that blood flow back. And as much as this is just great for cellulite, you know what? If I had knee problems, I'd be doing this too, right? And then I take it off. I come up a little bit higher with it. I twist it around me. And then same thing. I just grab and twist and then let it go. So now I'm not rubbing my hands up against my skin at all. I'm twisting the flesh around my thigh. Yeah? Twisting. Okay? So simple, right? You're not going to have to bruise yourself, but you bring a ton of blood flow right up to that skin. You can see how nice and pink it gets, kind of smooths out a little bit. I love that, okay? So there's one thing. Now, once I've done that, okay, another thing that I would teach you to do is a melt technique called back thigh shear. And what I like about the melt roller, two things. It's soft, okay, and it has a texture on it. Can you see it? So you're going to get these little pockets of air will actually give you a little bit of a better, you know, crimp into the tissue. So again, if I wanted to shear, I'm going to bring my leg down. I could even take the ends of the roller and curl them up, so I've got something to really work in. And I'm going to let my leg slide out, and I'm going to turn my thigh in and twist it. And this is exactly what I was just doing with the band. There's not much difference in it. It's just that it's more passive. I don't have to, like, so while I'm watching brainless television, I put a roller behind the back of my head and I sit there and watch TV while I do this. And I'm going to pick one spot, and what I want you to see is that I am not, just like I was with the resistant band around my leg or with my hands, I'm not rubbing my hands on my skin. That's nice to do when you first put the lotion on. Put the lotion on, massage your skin, beautiful, awesome, amazing. That's also going to reduce the appearance of cellulite, just getting some nice hydration on the skin surface, okay? But then once I've got that, I want to pin the skin and create the shear effect. That's what we need to do, is shear the collagen matrix. That's what draws and attracts the fluids back into the tissue. Okay, so I've been on one spot for, like, you know, maybe let's say 60 seconds. I might even just sit here and hang out for a second. And then I'm just going to take the roller, I'm going to move it down a little bit. And I'm going to repeat the exact same thing, twisting the flesh around my thigh. Okay? And so again, I'm not rubbing my skin up against the roller. I'm pinning the skin and creating the twisting effect. And you could do a similar thing to your arms. You know, ladies, if you're talking about the stuff on your arm, we can just go ahead and bring our arm down onto the roller. I could sit here and twist it this way. Right? So again, I'm not rubbing my arm up against the roller. I'm pinning my skin and creating the twisting effect. Yeah? I could do a direct shear. I could just sit here and punch my arm back and forth, or rotate it, doing an indirect shear. Right? So same types of principles. Okay? So that's connective tissue. Okay, if you want to work on fascia, I'm going to do maybe just so that I'm not uneven, right, is to, again, pin the skin and create the twisting effect. But let's talk about the process that we've done so far, right? So I'm saying, hey, first thing you want to do is put some cream on you. Massage it in, get your skin nice and juicy, let it absorb, and then begin to twist. So again, I'm essentially doing this to my skin, what I just did with my hands. I'm just doing it with the roller, pinning the skin and twisting. So simple, isn't it? It's so simple. And it feels great while you're doing it, right? But you really do need to create a shear to the tissue. So what is shearing is pinning the skin and the underlying substances against the bones and the muscles and all the other tissue in between, and you're twisting it. And all that's going to do is bring fluid flow, interstitial fluids, into the matrix, which is going to help our collagen, because collagen needs the water to bind. And ladies, I'm sorry to say this, but as we get older, our collagen production, collagen synthesis declines, and actually the collagen that our fibroblasts are producing is not good. Instead of looking like a crimp under a microscope, it kind of looks flat. And so that's a problem with it, right? Is that the quality of collagen that's being produced is not as great as we get older. So we want to stimulate those collagen receptors. We want to stimulate the fibroblasts. We want to stimulate the collagen matrix so that we continue to produce collagen. So doing tissue activation like this is just a great thing to keep that synthesis moving in our bodies. You know, if we're just sitting still, blood flow declines, and not for nothing, over time that could cause type 2 diabetes, and that really is a problem. You get like cellulitis on that instead of cellulite, so a whole bigger problem, right? So you see what I'm doing here, right? Just a twisting. I'm pinning the skin and I'm twisting. And then I wait, kind of like working fluid into a sponge, squeeze it out, wait. And then we're going to just find another spot and we're going to do the same thing. And I'm going to say this again, not only is this, good to minimize the appearance of cellulite, but you're actually helping your joints. You're going to help your hip and your knee by stimulating the tissue that's intertwined in these layers. You are going to help to support your joints, which to me is a much bigger reason why you should be doing things like back thigh shear. Okay, so there's my nice twisting action. Okay, and for me, again, when I'm doing this, I will get crazy and I will kind of obsess for a half hour working on the back of my legs. Let me see what kind of questions you guys have, seeing if there's anything. Lorna says, I've heard that having cellulite means you have lymphatic issues and aggravates. It's probably varicose veins and spider veins. Is that true? No, it's not true. Okay, so fascia and lymph are working together. So the interstitial fluid flow from the interstitial fluids of fascia are being driven into the lymph system by these pre-lymphatic channels. They actually pull the water out of the collagen matrix and into the lymph. So it's not that there's anything wrong with your lymphatic system, but again, what I can tell you is if you have cellulite, you have lost some quality blood flow through your body. The capillary system isn't moving the fluids as you want. And so a couple of questions I would have. How often are you drinking water? Are you sipping water frequently? Let's pause for a moment and do it. Very important to stay hydrated. Vicky is asking, does it work the same on the front of your legs? Sorry, I missed the first few minutes. Absolutely. So I'll demonstrate working on the front of my thighs, okay? So same kind of principle. I can put my hips up. You see where my butt is, so I'm not down like this. I'm gonna bring my body up, and I actually wanna glide a little bit here first. And so what gliding is going over the skin surface. A glide is more of a preparatory technique. And so you see what I'm not doing is I'm not ironing myself like a shirt. I'm just moving the roller a little bit into the thigh. And then I would do the same thing. I would just sit here and shift my body weight left and right. Left and right. And again, if we're really thinking cellulite, here I am very relaxed in my muscle fiber. And then if you want, squeeze your thighs and do it again, and you'll feel the difference. More superficial. And then I'm going to relax those muscles. And I'm going to help to stimulate those collagen bindings all the way down to the bone. And just remember, after you do a shear, just stop moving and just sit in that one spot. And then move to another spot and do the same thing. You're going to glide a little. Again, keeping your tail up a little bit so that you're not injuring your back or causing pressure on the back. And then you can do a direct shear. You could twist the flesh. Again, I could squeeze my thighs. I could squeeze my thigh muscle and try to do it here. And then I could relax again. I can also do an indirect shear. I could bend and straighten my knee a few times and contract the muscle against the interface of compression. That's also a shear. And then again, I just wait. Okay, and again, you can do this anywhere in your body. The thing you want to be mindful of is the duration that you do it, right? So if I had, if I'm really working on regions of my body where cellulite tends to be the most abundant, like the back of my thighs, my inner thigh, the back of my arm, maybe even the lower abdomen. If it were lower abdomen, I would do the same thing. Is I would, you know, like try to get into an area where I could just kind of like lie down. And I'm going to grab onto my skin. See, I just pinch the inch, and then I'm just going to roll it. Right? I'm just grabbing it. And again, if you have trouble grabbing the skin, right there you realize is you don't have enough hydration in the tissue. The superficial fascia should actually move quite easily. So when it doesn't, we know we have inflammation in the tissue. So we want to minimize that. So again, doing these things, you'll find that after a while, your tissue will supple up a little bit as you do it. But you could do that on your abdomen, you could do it on your arm, you could do it on the front of your thigh, right? I demonstrated all that stuff right on the front of my thighs with my legs like this earlier on, right? All of these things are exceptional for minimizing and reducing the cellulite. But really, you know, again, what are you doing is you're bringing blood flow back to the superficial fascia. And you don't need to bruise yourself, okay? Bruising, when you bruise yourself, what you're doing is you're rupturing capillaries. And then you're creating, they're called macrophages. They have to now absorb all of the dead blood that you've now pooled. And now you have these bruises, and now you have an inflammatory effect. And so through the stages of inflammation, as the inflammation slowly absorbs, you may see your cellulite again. So just because you scratch at your tissue and bruise yourself, if you swell, of course, if you get a lot of swelling in the tissue, you're not going to see cellulite because you've caused inflammation. But causing inflammation is not the solution for cellulite. It's just touch yourself more. We should touch ourselves more. Really, we should have other people touch us, but we should touch ourselves for sure. I mean, you know, get somebody else to massage you. That's always great. Let's see if there's any other questions, because I want to teach you guys a couple of strength techniques, because these are really important. Alyssa, you're saying, what if grabbing your skin hurts in a spot on the front outer part of your thigh? Yeah, exactly, right? So, you know, if you're like up here and you're like, wow, that is really freaking tender. Again, what happens when fat gets trapped in the collagen matrix? Don't think that it's just fat. You've got blood vessels there, there's nerve endings, right? So as you pinch, you're feeling kind of the restriction that now you're creating on the skin's layer. So if it hurts, I always say if you cause pain, that's your cue to ease back pressure, right? So somehow that's kind of tender right here. I might work a little bit further away from it and then kind of come back like a little sneak attack. And then kind of lighten up my pressure, and then keep working around it, and then leave it, and then go to another area, and then 2 or 3 minutes later, come back to the area that was sensitive and see if it decreases in its sensitivity. And if you feel less sensitive, that's a good sign that you brought new blood flow to an area that had restriction. And as you press, you're creating more constricture, aren't you, right? You're pinching it, you're pulling blood flow away. So it's when we let it go, that's when you get that fill effect. And again, that's going to help to support drawing fluid flow from fascia to lymph. Now again, let me go back to this concept of bruising yourself. I'm telling you, ladies, these ideas of taking a blunt object or things with knobs and scratching at your body to bruise yourself all over the place, you got to be really careful, because you could alter your endocrine system. Connective tissue is like one big endocrine gland. And so hormones are living in the superficial fascia, in that fatty tissue. And if you let loose too much of this, it could cause an endocrine response, put stress on your kidneys, kind of disrupt your female genital organs. It just disrupts the return or the junk dumping of waste into the body, and it can actually make you feel a little sick. So we don't want to go after every square inch of our bodies, and don't think that you can do something once and then never do it again. It's kind of like brushing your teeth. You know, you're brushing your teeth today so that people can stand your breath and be close to you, but you're brushing your teeth daily to prevent tooth decay in the future. This is very similar. So if we work on it every day, you'll see how it minimizes over time. But what I find, whether it's pain or cellulite or wrinkles or whatever it is, that people aren't proactive enough. This is a lifestyle kind of a change, so you need to add it to your daily life, and that's an important concept, is to really think of what am I doing in my daily life that's helping me every day, not just every once in a while. Okay, so that's an important concept too. I'm gonna see if I can answer a couple more questions, then I'm gonna teach you some strange. What's your little tool called? Oh, this is a gua sha, G-U-A-S-H-A. There's like skincare that are selling these now, but these cost like $4 or $5. You can get them online, G-U-A-S-H-A, 2 words, G-U-A-S-H-A, gua sha. Or maybe it's G-A-U-S-H-A, I don't know. Anyway. Kathy, yes, as you work on it, it should become more pliable, and over time it will. Vicki, yes, will it help with crepey skin? I feel like I have more of that problem, that crepey skin. The thing about crepey skin is also estrogen, right? As we get older, our estrogen levels start to decline, and that's another reason why we see cellulite. It's why we see the crepey skin, because we lose the testosterone to estrogen balance in our bodies. So something to really use every day. You don't need to spend $7,000 on a skincare cream. You just need to get some sort of cream and massage yourself. I mean, crepey skin is like nasty. I don't like that either, and it's probably one of the things I don't like the most. And again, sipping water frequently. Yeah, and the thing about water is always sipping it frequently rather than, so let's just say this is a liter of water. You'd be better off sipping a liter of water over the course of 3 hours rather than drinking a liter of water and then not drinking for 3 hours, because your body needs to absorb it. And again, a collagen molecule needs a water molecule to bind. That's what makes its triple helix. So we need that consistent water intake to help it. Also the things that you aren't eating, right? I mean, people, if you're eating a lousy diet, you're just grabbing bars and things like that. Try to eat more nutritious foods, eat more water-filled foods, eat more fruits, eat more vegetables, right? I mean, this is so important with that kind of stuff. It's such a simple aspect. Diana says, I always find when I do the shear and rolling, the roller runs away from me. What am I doing wrong? Okay, actually, this is a really good one, because Diana, you're not doing anything wrong. Let me teach you something about a shear. Okay, if you shear properly, I'm gonna start the shear at the bottom of my leg, and this leg's not on the roller. Okay, so I'm just kind of keeping it where it is. I'm gonna start with the roller. Let's just say, what is that? Maybe an inch behind the back of my knee, okay? And I'm gonna start doing the twisting. And what I want you to kind of think of is that the compression is consistent if I keep the pressure constant, and I'm actually thinking of pressing more on the curved top of the roller rather than the top of the roller. I'm actually keeping my knee soft. Do you see how my foot's staying on the ground? And so if I do this right, and I keep twisting, that roller, look at it, where is it now? It's coming up my leg, isn't it? And that's actually when you know you're doing it really well. If this leg isn't on the roller and you're twisting properly, that roller is gonna creep up towards your booty every single time because you're keeping the pressure constant and you're pressing the curved side of the roller. So you are actually backpedaling it back up. And so that's great. Okay, if you want it to stay still, you got a couple options. You could just drop your other leg onto it and do it this way. You could even put your foot on it. Just depends upon your flexibility. Okay, but the point here of a shear is, again, pinning the skin and twisting it, or grabbing the superficial fascia and then rolling it all the way up. Okay, and you're going to find as you start to do it, it's going to get a little easier for you. The tissue will become more pliable. It definitely changes. Okay. So now let's talk a little bit about strength, okay? Because the other thing that I find is, especially, let's talk about my ladies who talk about the back of their arm, okay? We've got 3 muscles, triceps 3, biceps 2. We use our biceps all of the time. Everything is very bicep related. You know, you're typing, you're driving, you're eating, you're exercising. Your biceps are like loaded with work. We probably need to work on our biceps less. But what we really need to do is learn to work on triceps more. And I love resistant bands for tricep work. And there's so many simple things you can do. Like you could just find something to hang a rope on or a band on and do it standing. I'm not going to do it that way. I'm going to do it this way. I'm just going to put the band on my roller so I'm a little higher up. I'm going to bring my arm towards me. I'm going to lift my elbow up high and I'm going to extend my arm. But what I'm not going to do is hyper extend my elbow. Do you see how I'm hyper extending? I just want my arm straight, okay? And I'm going to get that arm straight and then I'm going to bend and extend and I'm going to hold. Bend and extend and hold. Bend, extend and hold. And hold. And then I could even just sit here and go through that end range. And do you see that little shake that starts to happen? I love that. Because then I'm really isolating something. And then I could also bring my arm through a straight extension. And again, these types of techniques, not in quadruped, but these types of techniques are all over Melt on Demand. And one of the ones I want to teach you guys is one of my favorite moves. It's called the Arm and Hammer. And for me, this is like my winning one for triceps. It's like if I had to give you one exercise for triceps, this is what I would do. I would take the resistant band, I would put it down on the ground, and I would put the roller over it so that it looks like a lowercase t. Can you see that? Lowercase t. Okay, you're going to come on up onto the roller, and anytime you lie the length of a roller, a couple of things. First, make sure that you actually land on the top of the roller with your head. Make sure that your head's on the roller. And then the first thing you want to do is gently rock. So my feet are on the floor, just about hip width apart, and all I'm doing is keeping my forearms on the ground, and I'm just rocking back and forth. And the reason we're doing this is to help what we call the autopilot, that neurological aspect of stability, to go into action to stabilize us on the unstable surface. But the uniqueness of lying on a roller, we're lying right along our spine, and we never do that in a normal day. So we want to make sure that we don't kind of trip out our nervous system and create a stress response. We're actually looking to decrease stress, decrease that cortisol activation, and try to get our body back into balance. So you do this for about 30 seconds. And then keeping your pelvis neutral. So try not to tuck, just try to keep your body in a nice neutral state. You take your resistant band and you drape it over your shoulders. And it doesn't matter if one side is longer than the other, it's not going to make a difference, because what you're going to do is crumble up the band into loose handles so that the band is right near your temples. Okay, so you see I'm going to take my thumbs, I'm going to place them on my temples. And I'm just going to move my shoulder girdle a few times to really make sure that I'm setting my shoulder girdle up properly. Now there's, again, an entire sequence that really shows this whole process. I'm just showing you a couple of the techniques. So I'm going to go ahead, I'm going to allow my shoulder girdle to sink. I'm going to keep my ribs nice and relaxed. And then I'm going to pull tension on the band. And the secret of this one is to then create a little external rotation. So I'm taking my forearms and I'm making a letter V. Okay, so they're just a little bit wider than my elbows. Okay, and with the, you see I have resistance on the band. I'm just going to hold here for a second. And this is called neurological reintegration. It's a way to help that neural timing. It's also a great stabilizer of the shoulder girdle, but this will rock your triceps world here. Okay, so I'm going to hold on to this extension, and then I'm just going to try to extend my elbows halfway up to the ceiling. Can you see that little shake that's happening? I love that. And then nice and slowly, I'm going to return it back down. And all I'm going to do are 4 repetitions of this. I'm going to take a breath in, and on an exhale, I'm going to pull halfway to the sky. I'm going to hold. And then nice and slowly, I'm returning. Notice that my upper arm is not changing. It's only my forearm that moves, right? So just the elbow joint is actually active. My shoulders don't change. Again, I pull it. I find that little tremble. There's that neurological reintegration. And then I'm going to come on back down. And I'm going to do it one more time. I'm going to exhale. I'm going to hold. And then I'm going to bring it back down. Okay, and then we're going to do 4 full range. So I'm going to come all the way up to extend, and then nice and slow, I'm going to bring it on back down. And again, I'm going to exhale, and I'm going to slowly extend. So again, take a look at how it's just my elbows that are moving, right? It's not a movement down here, and nothing else is changing. It's just the elbows extending. And again, I got to go to that full range. Notice that my wrists are staying in line all the way, so I'm not extending my wrists. And I always have tension on the bands. I'm extending it up. And then I'm going to bring it on back down. And I'm going to do 4 without pausing. So I'm just going to extend, and then I'm going to come down. I'm going to extend, and I'm going to come on down. I'm going to extend and come on down. And one more time, I'm going to extend. And I'm going to take a little challenge here. I'm going to come halfway up, and I'm going to pause, and I'm just going to pulse. 4, 3, 2. I'm going to hold it there, and then I'm going to release it all the way down. So those subtle movements are going to get a ton of blood flow back into the shoulder. And when you do this, you're bringing fluid flow back into the shoulder capsule by way of your triceps. And it's just an exceptional way to bring hydration and muscular engagement back into an area that's like a sleeper muscle for a lot of us. So if you feel like you have neck pain or shoulder issues on top of this helping you with your cellulite, it'll actually just help to improve the tone so that you've got, you know, less of the jiggle when we're done doing the technique, which I also like. I'm gonna see if anybody has a question about that technique. That's one you could do every other day. I love that one. There's a ton, yeah, I see Carrie saying other neurostrength moves with the shoulder girdle, seated, standing, but arm and hammers, this is my favorite one. I love this arm and hammer move. It's just one of my favorite ones. And again, it allows your shoulder girdle to sync with gravity. That's the uniqueness of it. So again, instead of my arms being here, I had my arms externally rotated. I came up half of the way, and then I came up all of the way, and then I brought it back down, right? It's a great technique to do. Now again, for the lower body, there's tons of different techniques, but the one that I'm gonna show you right here is a bridge. And bridging, to me, if I had to give anybody some type of a technique, I'm gonna show you one of my favorite ones called a knee knocker. So I'm gonna use the Milt Performance Roller, my travel roller. I like this travel roller. It's smaller, I carry it everywhere. It's kind of like my best friend. So here what I've got, my feet about hip width apart. My upper body's gonna stay relaxed. The uniqueness of this is most often when people do a bridge, when we're weak in the lower fibers of glutes, this is why we get this cellulite right here. This is the lower fibers of glutes. 80% of your glutes attach to your TFL in the IT band, the TFL, and 20% of it actually attaches to the femur. And that 20% that attaches to the femur is, again, a sleeper region of the booty. And so when people talk about saddlebags or they've got that like saggingness at the outside of their legs, this is one of the ones that I would do to tone it up, on, as well as clams, inner thigh, side leg lift, all of these other techniques of melt. But this one is just simple, okay? So what I'm gonna do is focus on what's staying stable before I move. So my ribs are gonna stay out of this. I'm gonna focus on pushing into my feet. I'm gonna squeeze the roller with my knees, and nice and slowly, I'm gonna bridge my hips up. And once I think I've gone as far as I can without my mid-rib wall, so below my shoulder blades, I want those to stay not lifted, right? So I haven't come up from here, right? So I'm not arching my back. I'm keeping my ribs down so that below my shoulder blades, I've got weight on the floor. And once I'm here, I'm squeezing that roller, and now I'm really gonna think about clearing out the crease in the front of my hips. And a lot of people, when I evaluate them doing this move, they can't get here. Their glutes are so weak that the only thing they can do when I ask them to lift higher is to go like this. And I get that. Like, okay, so now my crease is lifted, but that's all my back that's gotten me there. My glutes haven't done it. So what we lose is the terminal end range of hip extension, right? So I should be able to come about 20 degrees into extension with the back of my hip. And a lot of us maybe have 5 or 6 degrees of it, okay? And it's just weakness. So again, you really have to plant your feet. You're gonna bring your hips up. You're gonna try to keep your ribs out of it. Some things I always think about is kind of sliding my heels away from my ribs so that anchors my ribs. I really wanna kind of feel my ribs are staying down. I've got my feet planted. I'm squeezing my knees into the roller. And now again, I'm gonna think about reaching my knees forward to try to get my glutes to take the activation. And there it is, right there. And then nice and slow, I kind of think about squeezing more to the top of the roller, and I come back down. I'm gonna do this 2 more times. So again, my ribs are gonna stay quiet. I'm gonna push into my feet. I'm gonna just do a very specific bridge. Same thing, I'm thinking my heels are sliding away from my ribs to keep my ribs anchored. I'm squeezing my knees into the roller. And again, I'm gonna try to reach my knees over my toes to get the lower fibers of glutes to activate. This is where I'm getting the work right here. And it's burning on fire right now. I mean, I got it. And then nice and slow, I bring it all the way down. So I don't need to do more than 4 here. I'm just gonna do 4. And this is, again, neurological reintegration. We don't do these things to get rid of cellulite, okay? But what we do is to try to get that neural timing back into the weak regions of our body, because the stronger the muscles are and the better that neural reception, better blood flow, better mobility, better stability, your legs are gonna be more toned, right? So again, I'm really lifting here. And now I'm gonna go for the pattern. I'm gonna let my hips come down. I'm gonna lift up 1. I'm gonna come down. I'm thinking reaching my knees over my toes 2. Reaching my knees over my toes 3. And then 1 more time. And then once I'm here, I'm gonna go ahead and I'm gonna squeeze that roller in. 1, 2, 3, 4. And then nice and slow, I'm gonna release it all the way down. Now, if you did that with me and you feel a ton of work right here in your booty, you did it. That's exactly what we're looking to do, is to improve the activation of the weakest link of the lower fibers of glutes. These are the areas where if we lose the tone, you're going to lose blood flow, you're gonna lose muscle activation, and that's gonna show you appearance of cellulite. So it really comes down to hip extension. I mean, I could also demonstrate a hip extension by doing something where I'm coming down onto the roller here, I'm tucking my pelvis, and I'm trying to bring my hip into extension, right? So if I try to bring it up, most people, when they bring their leg up, arch their back, right? I can make my leg look like it goes really, really high, right? But that's not my hip that's moved, that's everything but my hip, right? So if I take my rib extension away and I try to lift, that's as high as I can get my leg. You also want to notice if your leg has dropped inward, again, you're seeing weakness. We want to create the external rotation as we lift and then bringing it down. Right, so this is exactly what I did. This is just called an open chain technique, meaning that I'm not pushing my body weight against the floor. I'm gonna do it 1 more time. And then I'm gonna bring it down. Okay, same types of principle, single bent knee and single straight leg extension. Those are also melt techniques. If you go to meltmethod.com, there's videos that demonstrate it. There's sessions that have those techniques. But the one that I would try to master is a bridge. I'm going to see if there's any more questions on these ideas that I'm offering out to you guys today. Chantel says, why is it when I do tricep exercises, my triceps are sore for days and I feel numbness in the palms of my hands? Should I shear the chest area? It seems to help. I guess it's typing all day long. Yeah, that's just it, guys. A lot of times when we do tricep exercises, your form is terrible. I hate to say that. But oftentimes when we do a tricep extension, we are medially rotating the arm as we do the extension. And what that's doing is it's creating compression into the nerve plexus that goes down under your collarbones into your arms. And so your hand will feel numb or you'll get tingling. So when we did the one I taught you was to bring our arms into external rotation and try to do your tricep extension. Very different than how we normally do tricep exercises. Even when I showed you the one where I was sideline, or when I was standing, I'm not letting my shoulder go in. I brought my shoulder back, and then I created the extension. And again, a lot of people, when we go to look at their shoulder is completely protracted because you have weakness in the deep stabilization aspects of your shoulder girdle. And that's a whole other conversation for another day that has nothing to do with cellulite, okay? But I mean, I could go down that rabbit hole with you. But for sure, if you did some gliding and shearing across your chest, maybe a sternal decompress, the upper body stability sequences, things like that, that'll definitely help you out with those kind of issues. Yeah, Nicole says, when I try skin rolling, it's really hard to get just the skin. Will it come over time? Yes, but understand that your skin, you can't just grab the skin. It's not just like, I'm not just grabbing my skin here. The superficial fascia comes with the skin. And what I really want you guys to understand is in different areas, like see how I can pinch and how thin it looks? But if I pinch up here, it looks thicker, right? Down here, it looks thicker. Right? Because our superficial fascia is not one cohesive thickness throughout the entire body. In some areas it's thicker, some areas it's thinner. It's thinner up here, right? I can barely grab onto it. I would have to really slacken my skin to grab the tissue up here, right? But here I could grab it, right? But yeah, if you have a lot of inflammation in your superficial fascia, which is like a lot of us, you're going to have a hard time grabbing onto it. I actually was with a friend the other day and he was talking about his back pain and I said, here, let me do a little skin rolling. And when I first tried to grab the skin on his back, I couldn't grab it at all. It was just so inflamed, right? And so I just gave it about 10 tries and then I went away from that and did some other techniques and then went back and I could then start to roll and he's like, wow, that really feels different. And the next day he calls me, he goes, man, my back feels like so much better. That's crazy. I said, it's just blood flow. We just bring blood flow to that area. So it's pretty powerful, those kind of techniques, yeah? It's just simple. Simple, 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 simple. To activate my tight iliacus so as second on the, I'm not sure what, Lulu, what you're asking me that activated my tight iliacus. Or you're talking about a mini bridge? Mini bridge, if you're not doing the, Lulu, that's not a good mini bridge. You're not doing it quite right. If you get psoas to activate when you're trying to create extension, psoas isn't an extender of the hip. If anything, it's going to assist in flexing the hip in particular positions. So if you're getting that bridge and you feel like some sort of tightness in the front, we're going to work more on inner thigh gliding and shearing, back thigh shearing. You need to get some better stability in your pelvic floor and your legs and then transition into a knee knocker. There's another technique on Melt on Demand called the mini bridge. I would put you to a mini bridge where your hips are on the roller and all you have to do is come up an inch to make sure that you're going through the range and actually activating the lower fibers of glutes. That's a poor timing hip position. We've got some other things to work on with you. Totally out of the scope of cellulite. Thank you, ladies, for not asking me about cellulite. I have made an impact on that. Okay, so I think all of these questions you guys have asked, I think that's great. Yeah, it just is what it is, you know? It just, yeah. Okay, so to end this conversation about cellulite, ladies, you're not broken. It's not a condition. I don't think cellulite is a condition, okay? You know, it's part of human anatomy. Women are gonna have it more than men. I think if there's a couple of things I would say, I think we need to love ourselves better. I think that we need to find the beauty in all aspects of our body. Again, my late husband used to call all the spots that I hate on my skin my constellations. It's my fairy dust must have gotten on me when I was first practicing how to use all of my magic. I love those kind of things, and it made me kind of love the aspects of my body that I would like to be different, right? I would love to have that cocoa butter skin where I could get a spray tan and it looked even. I just look like a leopard of some sort. I got spots all over me if I tried to use it. And so I just embrace myself for who I am. I don't need to self-mutilate my body. I don't need to bruise myself in every square inch of my body to become one with the universe. We are all connected. We're all good. We all are full of love. Just give that back to yourself and take a little bit of time. If you want to see your body change, you have to commit to a lifestyle change. And that's what the Melt Method is all about. It's not a quick fix. This is a lifestyle brand. It's a way to engage in your life and deepen your understanding and your compassion of yourself, and to try to give back to those aspects of your body that keep you stable, a little bit of added support from day to day. If this has intrigued you at all, I also want to point out that this summer we are coming back in a live setting. There is a live melt event this July at Red Mountain Resort. If you want to find out more about that, go to meltmethod.com and check out our events. Carrie and I will both be there, along with Amanda Sizik, two master trainers. And it's a 3-day immersion into the melt lifestyle and giving you guys strategies and quick ways that you can do some of these techniques when you're watching TV, do a little bit before you work out, do a little bit at the end of the day, but give back to your body. And as you do these things, don't think that you're trying to fix something that's broken. You're trying to enhance the quality of your blood flow and the fluid flow in your fascial system to improve your overall stability, because fascia is the stability system of your body. It's enhancing your neural stability, your cellular stability, your mental and emotional stability. Fascia is inherently linked to all of it. So let's love this aspect of our body, not suck it out, not inject it out, and certainly don't scratch it out of your body, because that's just not the way to take care of yourself. So to end this today, remember, make sure that you subscribe to the channel. Just click on the subscribe button below. If you're curious about Melt Method or what we've talked about with Melt on Demand, go to meltmethod.com. It's my streaming platform. We've got a ton coming this spring. We're having live classes on our new on-demand platform. Carrie's going to be there along with a number of other fantastic instructors. So you'll be able to take some live melt classes on a variety of different topics. And if these kind of things intrigue you, make sure that you leave a message below and let me know if there's something that you want a conversation on. I'm happy to talk about anything wellness, health, movement, and lifestyle related. I'm happy to try to continue to help you. And of course, sip water frequently, eat water-filled foods. Do me a favor after you listen to this, is reach out to somebody that you love and call them today. Just pick up the phone and just make a random act of kindness and tell somebody why you love them. And I hope that you do that for me, because it just elevates the frequency of the whole universe. And I do hope that that helps you. Oh, wish it occurred to ask about adding collagen. I do add collagen to my food. I have collagen powder, collagen liquids. There's so many great brands, but 100% use collagen, ladies, 100%. That one I would definitely tell you, use a collagen supplement. It definitely does aid, but the hyaluronic stuff, save your money on that stuff. And again, you don't need to buy a $400 bottle of cream. Just go to, like, I don't know, I think we got this at Beal's or something. I think it costs $9. So, again, just massage yourself, love yourself, give yourself a hug and tell yourself, I'm worthy, I'm good, I'm healthy, and I love myself. I love you guys for being part of the Melt community. Thanks so much for being a part of this YouTube conversation. Share it with your friends. Happy melting.